officials and really at the center of the school reopening conversation. And it's a conversation that is constantly in motion, almost on a week by week basis, I think it's fair to say. And Faris and Jen have kindly offered to start us off tonight with a 10-minute or so overview of the status of school reopenings across the county. So we're going to start off with that, then we'll get into questions. As Tulsi said, please continue to type your questions into the chat box and we'll be reviewing those. And without further ado, Faris and Jen, please take it away.
Thanks, Nick, and good evening, everybody. It's great to be here speaking with you about the reopening of schools and to give you an update and also to answer your questions. It is my pleasure also to be here with Jennifer Buesing, our Director of School Safety, and we'll be sharing just a little bit of information, and then we'll be going through some questions, and of course open it up for your questions in the audience. So I want to start by sharing my screen and just walking through a brief overview of how we got to where we are today. And let me go ahead and start this slide presentation. And so, you know, when I think about the fact that we've just passed the milestone of our schools having closed for in-person services for a year, you know, that there have been so many challenges that we've confronted and also so many opportunities for us to be able to think about schools very differently. We've been collaborating with our school districts, private schools, our childcare providers, mental health service providers, health clinics, and really working with that push-pull of school reopening. And that's been one of the challenges for us throughout this process is looking at how do we balance the safety for students and staff with our wanting to return to what was normal, or what we would consider normal, back to where we were before the pandemic. The reality is that the pandemic has really brought to light so many inequities and has really exacerbated those inequities. And when we think about the academic and mental health challenges our students have experienced, the digital divide and the number of students when we started the pandemic at about 10% of our students not having internet access, and also the differences between private schools and those who could afford private schools and our public schools, and the different ways that they responded to the pandemic. And what has been really challenging for us has been looking at the constant pivoting and the moving targets, the changing guidance, and it has brought up a lot of frustration for our community, our parents, our students, and our staff. And one of the big successes we've been able to achieve as a community has been the vaccination effort of our educators. We were the first county in the Bay Area to be able to vaccinate all of our K-12 staff, and that's been something that has really helped us move forward with being able to with the reopening of schools. I wanted to share with you a little bit this one graph, and I'm not going to spend much time on it, but there's all these different people that are involved in decisions and recommendations when it comes to the policies that take place. We hear from the Center for Disease Control, the California Department of Public Health, of course, the CIF for in sports and school sports, and of course our local public health officers, and all of these different entities are working together to come up with what we see as local policy and practice. But I wanted to highlight that the California Department of Public Health really is the most important authority in this whole process. And much of what we do ends up being interpreting, understanding, and implementing what the California Department of Public Health has shared with us. And so these other entities, we hear, oh, the CDC is thinking this, or you know, our community wants this. We really always go back to what the California Department of Public Health tells us, and that's really the authority that we follow in all of this work. We have spent quite a lot of time working on preparing our schools for a safe return for our students, and everything from screenings, making sure that students are going to wear face coverings, having stable groups, modifying our HVAC system and worrying about air quality, doing surveillance testing, having quarantining and isolation protocols, physical distancing, and that's a key item I'm going to be discussing a little bit in a moment. Making changes to the environment, like having plexiglass in the offices, cleaning and disinfecting with EPA approved cleaners, and of course the effort to vaccinate all our teachers and our support staff. all of these pieces work together to minimize the risk for students and staff and our community. And we have really made a very strong effort to make sure that these pieces are in place. When we think about the reopening of schools, one of the most important factors has been the distancing of students inside the classroom. And that's been one of the most hotly contested areas for us, because we were working with the California Department of Public Health that said you have to build your schools with 6-foot distancing between desks. And that's, until last week, that was what we were following. And then last week, we heard that that distancing requirement has been lowered to a minimum of 3 feet, which allows us to be able to incorporate more students into the classroom. But this process is unique for each district. Everybody's looking at the space issues, but we're also negotiating with our labor partners. We have to look at things like furniture. We have to incorporate the idea of scheduling, especially for secondary students. And of course, the final authority rests with the school board. And so this has created very different timelines and very different approaches from each of our school districts in the county. And we have 10 of them, some that are relatively large, like the Pajaro Valley Unified School District, and some that are very small, like our smalls, that have, maybe 120 students. What we do know is that we will be fully reopening our schools in the fall. And that's something that's one timeline that everybody is able to agree to, and really see that is something that we have to, there's no way we would want to begin our schools as long as our community transmission rates continue to go down as they have been. That is our plan, is to open up. But the discrepancy or the idiosyncrasy, like the uniquenesses of each of our school districts has created a variety of different dates for reopening, and also different approaches. Some are opening in a hybrid format. Some are opening with full reopening. And so we have different dates for different grade levels, as this chart shows you. And I believe this was the chart was has been shared with you in the past and on Lookout and in other areas and on the Sentinel. But you'll see that we have all these different dates for these different grade levels, and that has created some inconsistency and of course some frustration from parents who look to other districts and say, why is my district different than, why are my kids having a different experience than kids in other districts? I did want to share with you that we got some good news very recently from the California Department of Public Health, which was that there's new graduation guidance that will allow us to have outdoor events where we will be able to do in-person events, and they will be on a limited capacity in terms of seating capacity, but it's based on our tier level. So right now we just went into the orange tier, which is very exciting for our county. We're hoping we'll move into the yellow tier, and the more we continue to progress with those metrics, the more likely we'd be able to have larger numbers of people. Of course, we still have to adhere to things like assigned seating, distancing, masking, disinfecting. There's entry and exit procedures, a lot of rules to come into this, but we're very excited because for a lot of our students, having a drive-through graduation or a single person graduation or virtual graduation just wasn't the same. And we're hoping that we can return to that closer to normal when it comes to graduation this year. We've also received some new guidance in the sports area. And so specifically for indoor and outdoor high contact sports, like indoor high contact sports like basketball, outdoor like football. And so outdoor sports are proceeding. Students don't need to test because we were in the red, now we're in the orange tier. For indoor high contact sports, while we're still in the orange, students will have to test. They'll have to do 2 PCR tests a week, and staff that are working with them. And observers are still limited to immediate household members, and for the strict purpose of age-appropriate supervision. And so again, coming from the California Department of Public Health, our role is really just to get as much clarity as we possibly can, which sometimes is challenging, and then implementing the guidance that we receive. Some good news that we are receiving is that the schools are getting additional funding from both the state and federal government. This is to help for students who've experienced learning loss, and many students we know have not been successful with distance learning and are going to need additional support, additional time, additional opportunities for learning. And also students have experienced a lot of mental health issues, and the funding can be used to support students with therapeutic services. Also with the costs of implementation of COVID-19, so HVAC system upgrades and other costs that the schools have either already spent or are planning to spend, like the acquisition of new desks because the old desks don't conform with the new distancing requirements. And the funding also has incentives for schools to open for in-person learning, and that's something that is giving students additional motivation to continue this process. We're very excited to have our students in the classroom. I have to tell you that on March 3rd, the first day, I got to visit Scotts Valley Schools when I was the first district to open up, of our public schools to open up for kindergarten, and it is absolutely amazing seeing students back in the classroom, teachers teaching in person. We want more of that. We want to make sure we do it safely and thoughtfully, but that is definitely what all of us are working towards. The County Office of Education is going to continue working to support students as they return to the classroom, and we hope to help develop the services that we have to put in place, whether it's summer school, whether it's after school programs, different ways to help students get reconnected with school in person, get back on track with their academics, and also as much support as possible to help them through any of the mental health challenges that they've experienced. And we also have to be very careful and be very thoughtful. We don't want to, we can't relax when it comes to safety and health. And so we have to continue to adhere to the guidance when it comes to keeping our face coverings on and making sure we're continuing to distance, even when for those of us who have been vaccinated, those kinds of the requirements we have to adhere to make sure that we continue on this track, on this positive path. Moving forward and being able to get us back to more of our students coming back to school in the classroom. And so that is my short overview, Nick. I hope I didn't go over my time on that one. And just want to thank you for the opportunity to share a little bit of information.
Well, there was a lot there that we'll follow up on, and thank you for doing that. It was very informative. But first, I want to bring in Jen. And Jen, as so many districts and schools are reopening, there's also the possibility of them closing again with transmission in a classroom or even exposures in a classroom. And we've had a few weeks of hybrid in several districts. And I guess I would just ask you, have there been any issues? Have there been exposures or classroom closures to this point since hybrid has began? And can you walk us through how that works if there were to be one?
Absolutely, thank you. And to everyone, I'm happy to be here. Again, my name is Jennifer Buesing, and I am our safety director at the County Office of Education. And during COVID, my role is also to serve as the public liaison with our county public health department. And we have a team devoted just to schools and preventing cases in schools and transmission, and then of course responding to exposures or positive tests in schools. And, I want to remind everyone, schools have been open for a long time to some degree. We are increasing those in-person services, but we have been very successful at our targeted small group interventions, and as well as some of our private schools have been open for some time. And in our public schools, we've not had any outbreaks. There have been a handful of cases in our schools, but there has been extremely little amount of transmission in our schools. And that is thank you to the guidance from the California Department of Public Health and to our local public health department in collaboration and all of the hard work of our schools. It is really difficult to quarantine and isolate, I know, for families, but that is one of the really important things in order to do this safely, is that we not send kids to school and staff not come to school if they have any symptoms. They would need to isolate if that is the case. And then we do have to quarantine those that might have been exposed to someone with a positive case at school. And they would probably go to distance learning and likely quarantine for a couple weeks and then come back in person. And that's how we've been able to prevent transmission in schools. And in terms of closing schools, since we have reopened for hybrid a couple of weeks ago, we have not had to close any schools. So we've not had to close any classrooms. And in general, now that schools are open, And regardless of what tier we go into, schools do not automatically have to close. And we will be, of course, really cautious and incredibly safe, but public health in collaboration with our schools will not be quick to close a school again. One case in a classroom would probably look like closing that classroom, going back to distance learning. If there was multiple cases in multiple classrooms, it could close a school, but that would have a lot of collaboration and communication with public health. We will not be quick to close a school, and I do not anticipate that having to happen for the rest of this school year.
Well, thanks for that. And I also want to turn back to something you said, Faris, which is the changing classroom distancing guidelines, which is quite a recent event. I know districts are still reacting and plans are still taking shape, but I do want to know, for this spring, what is your expectation around whether or not we could see wider classroom reopenings? There's been a little bit of talk of that at Santa Cruz City Schools, maybe a few other districts. What do you expect to see, and could that lead to wider reopenings?
Yes, I think that, with the changing, it did kind of surprise us a little bit how quickly that came down, because we had been working with the 6-foot distancing for basically this whole time in the pandemic. And then the CDC came out with their guidelines that said that the research showed that there wasn't much of a difference in terms of transmission risks when the distancing is reduced from 6 feet to 3 feet. And I think it's important to highlight something that Jennifer just said, which is that we have had such virtually no transmission in schools in our classrooms, right? And so I think that not only are we hearing that the risks are relatively low in our schools through the research, but also that we've experienced that both in the private schools and in our public schools. And so when we learned that the guidelines had changed, all of us working together, because all of the school districts, we work together very closely and in support of each other, looked at what that would be, what that would mean. And I tried to highlight that in my brief presentation, that there is really a discrepancy between, or some inconsistencies between how we're able to implement these changes, because we have to there's so many moving parts when it comes to that. I'll give you an example. In one of our school districts, the majority of their classrooms are 2-person desks, and which would make it impossible for students even to be at 3-foot distancing if they both sat at that desk. And so that would require them to change out all of their furniture to be able to create individualized desks. And so I think that the school districts are looking at this very carefully and really wanting to be able to increase the number of students that are participating in person. We've also heard from a lot of parents that have told us they're very concerned, and their perception of risk for their children and for their families is that they have concerns about that. And so I think it's not quite as simple as thinking that we're simply going to move forward and just open up all our schools that quickly. And we have heard from Santa Cruz City Schools and some other school districts that are looking to move forward with 5 days a week and 4 hours or more for all students. And I think that is something that we're going to continue to support them with. But I think that there's going to continue to be inconsistencies between how different schools are implementing that. And it does include things like furniture. We have to incorporate, of course, thinking about air quality and also the fact that these are negotiated items that involve our bargaining units, and that the ultimate decision rests with the school boards of each school district. And so that those different variables create different timelines and different implementation strategies.
Makes sense. And quickly on that, Jen, I'm wondering, is there a primary challenge or concern on the classroom infrastructure side, on the safety side, with shifting to this 3-foot distance, and especially doing that in a period, I think there are 8-9 weeks, depending on the district left? Is that a logistical challenge? And what are the primary concerns or obstacles to actually rolling that out?
It is a logistical challenge in some school districts. Some schools are better suited and more resourced and able to make that happen, maybe our smaller schools. And the 3-foot distancing, I just want to note, is just in the classroom. So there's other areas such as eating or outside the classroom where students might mix. we have to keep those at 3 feet apart as well, which also complicates things because for contact tracing,
At 6 feet apart, I think.
Remains 6 feet.
Yeah. And then just going to speed along here because there's a lot to get to and only a little bit of time. But I do want to ask, Faris, you mentioned the different approaches we're seeing in districts. And I think we also see that around hybrid schedules that have rolled out in the hybrid timelines. And just to offer one example, I think Scotts Valley Unified now has all K through 12 grades in some form of hybrid learning on campus as of today. Pajaro Valley Unified has yet to begin transitioning into hybrid. That's coming, I think, next week. So clearly there is a patchwork and parents have raised questions about it. And how do you explain why we see those differences? And what should parents know about why that might be the case? And that question for you, Faris.
So I think that yeah, the differences as I explained, I think are to the different kind. Can you hear me?
You're breaking up a little bit. I think it's okay.
All right, let's see how that is. I hope that's better. Am I still choppy? Okay, good.
Sounds good.
So yes, I agree that there are some differences that have, you know, and as I explained, Scotts Valley, as you mentioned, opened up their first classrooms on March 3rd, and other districts are you know, they're going through that process. And so I think for parents, I think I would first ask that they recognize that we're doing our best to try to implement the hybrid schedules. Everybody is committed to bringing our students back in person. And I also think, though, that, you know, one of the examples that Jennifer mentioned about, you know, lunch periods, for example, is one of the big challenges. So we can do 3-foot distancing inside the classroom, but how do you do lunch periods with 6-foot distancing? So you can't have them eating in the classroom at 3 feet. So then you have to get them out, and we don't have the furniture or the, you know, to be able to do that. So many of the schools are thinking, well, then we're gonna do to-go lunches. There are so many different parts to the equation, right? And there's also, I think it's important to keep in mind that as we're thinking about all of these different pieces, that we are trying to also keep in mind that the students there have been many students who have been successful with distance learning, and we don't want to disrupt that either. We've also been implementing students in hybrid instruction, I mean, in small groups. And they've been receiving services 5 days a week, and that's been happening since November for some of our highest need students. And so one of the challenges for us as well is to think about those students and not wanting to interrupt the services that they are getting as well. And so all of these pieces create a different timeline with different implementation strategies in our districts.
And one other piece to that, and I think you hear some people raising these concerns at district meetings, is bargaining with teacher and staff unions. And I guess, is that a factor in the patchwork that we see? And how do you think about the role of having to actually negotiate some of these timelines, some of these schedules with teachers and staff?
Absolutely. I think that, you know, all of these components that we're talking about impact the conditions of work, and anything that impacts the conditions of work is negotiable under the bargaining unit. And that's one of the biggest differences between our private schools and our public schools, is that we work with our bargaining units. And I think that overall the working relationship has been outstanding. Our teachers and our classified staff have done an outstanding job in working. When I think about what our classified staff has done, our bus drivers, our food service workers, our instructional aides, and of course our teachers who've been working extremely hard with our students. But that process in moving forward with the implementation of in-person services is a negotiated item. And so one of the reasons we were pleased that we were able to vaccinate our staff and do it so quickly is because it was one of the requirements that our bargaining unit members asked of us for the negotiation process. They said, we want to be vaccinated as part of the process, and we made sure to do that. And so I think that negotiation process adds another variable that also creates a different implementation depending on which district you're in.
Makes sense. And turning to the fall, you talked about the fall during your presentation, and yourself and the 10 district superintendents sent a letter last week saying, I think, that you were confident that we will see a full school reopening in the fall unless we see a reversal in the COVID-19 case trend. And it's really that idea that I want to ask you to expand on. What scenarios do you think would prevent us from a full reopening in the fall? And Jen, I'd love to bring you in on this one too, in whatever order you'd like to start. But what would actually derail those plans, and do we even know?
I mean, I think that, we've seen it around the world and in other states where the kind of misguided approaches and over relaxation to the restrictions has resulted in closures. In Europe, there have been kind of multiple phases where I think folks moved too quickly and resulted in increased transmission rates, and then school closures once again. And that is absolutely something we do not want to happen. And that's why we are constantly asking people to continue to do their best, to do their part, to adhere to the guidelines and being as safe as possible so that we continue this positive trend that we're on. And I'm going to pass it over to Jen to speak a little bit more about this.
Yes, I think to plagiarize our local health leaders, it's the VVV, the vaccine versus the variant. And there is, of course, so much that we don't know: how COVID responds to the vaccine, how we respond to COVID, but then also the concern about the variants and what will happen in the future. We are on a great course, and I hope that we continue on this course, but it's similar to that unknown. And I think that what might prevent us from reopening next year would be if the variant, if we didn't respond to the vaccine like we anticipate, and if the variant got out of control and our case rates skyrocketed again. But I do not foresee that happening. I certainly know that our local health leaders and all of our schools are working hard to get all of our schools completely reopened as soon as possible, and especially next year. So I think it would take something large to impact that, and probably direction that came from the state, California Department of Public Health, that would direct and recommend us to close.
And do you think, are there any specific case rate or numerical thresholds that are being talked about in terms of what would reverse that course? I mean, we have now the color-coded tiers, in a purple tier like scenario, would that derail a wider reopening in the fall, for instance? And are there any specific numbers or thresholds that are being discussed?
There is not at this time, because we are allowed to reopen, and we are, even if we return to the purple, we would not be required to close. So I think that would be a specific question with our local public health department. If there was, an outbreak that was uncontrollable, our local public health department may recommend that, but I think it would take something much bigger for the state to come in and make some changes, but I don't anticipate that happening.
And then the last question I had on the fall is, there may also be some parents who still remain uncomfortable with in-person learning. And I wonder how you think about that. Will there be remote learning offered to every district in this county? Will it be a patchwork, and what should we expect?
I think that, one of the challenges for the schools right now is that the more choices that we offer, the more challenging it is. I mean, it's the same way as when you build a schedule for a school. The choices create variability, and the variability makes it more and more difficult. And so being able to offer both full reopening and hybrid at the same time is virtually impossible, for example. And so the schools are committed definitely to be offering distance learning right now. I think we're committed as a county office to continue to offer solutions for families if they are interested in continuing with distance learning next year. And I think that that's something that we'll be working on as all of the school districts together, because we do anticipate that that's a possibility. And also, some students were very successful in distance learning and may prefer it as an option. I think that one of the long-term impacts of this pandemic from a kind of a learning and the teaching and learning point of view is the flexibility with incorporating more asynchronous learning or distance learning or online learning as part of the learning experience for students. And so I anticipate that being a long-term option that's going to be available for students. And I think that it's a way that we can also expand the number of kind of different kind of coursework that students can take. They would be able to take a wider range of courses if they take some of their coursework online. So that's something that I think that we're going to be working on and making available to families.
Got it. Well, that'll be interesting to see what shape that takes. And I'm going to resist the temptation to ask you more about how you're envisioning that, because I think there's a lot else that we need to get to. And one of them is, I see a question about this in the chat, and I'm going to get to the way that this attendee is framing it. But it's about the impacts to students during remote learning and during the course of this pandemic over the past year. And I think we've spoken about this, Faris, we've spoken about this, Jen. There maybe are two sides to that: academic impacts and socio-emotional impacts. And I want to at least quickly touch on both of those. But to start, do we know the extent of those impacts yet? And how are you thinking about just assessing what has been lost in either of those categories as students return to school?
I often say that I think we're going to be learning about the impacts of this pandemic on our youth for years. I think that we know anecdotally high incidence of anxiety and isolation and depression and suicidal ideation. Many of our highest risk students, some such as our LGBTQ community of students, have experienced higher levels of mental health challenges. And I think that the learning loss aspect of it as well has been something we've been quite worried about. We haven't been doing a lot of testing and a lot of the and I think I'm glad we're not, because I think it'd be very difficult on students to add that to what they've been experiencing. But I definitely think that learning loss is something that we are seeing both anecdotally, and I think there's going to be a lot of evidence of that in studies. And I think that part of the process is having authentic assessment of students. And as we bring our students back and as we continue to work with them, we're going to be, as we engage them, is learning about the different parts that they have had challenges with. And we're seeing some of the metrics we look at, like students' grades and some of the formative tests or assessments that we do are showing that many students that there is kind of a split effect that's happening, where large groups of students have not been successful with distance learning while others have. And so I think that really does call us to action to be able to, better understand how students have been impacted, and then make sure that we are organizing our resources to be able to meet the needs of students, both academically and socio-emotional. Jen, do you want to add to that?
Yes, just that we have anecdotally heard a lot of concern and seen some, but I think we have a lot of concerns, excuse me, about what we might see about the stress, the mental signs of stress, the physical signs of stress. We have reports of depression, regression in developmental milestones that have already been achieved. And I think our teachers, we've been training our teachers on what to look out for, such as not showing up, reduced engagement, students not being interested in what they once were, talking about the concepts, talking about death or not wanting to be here, just that negative self-talk, feeling worthless, poor performance in class, distractibility, irritability, and that might look like increase in fighting and arguing, lack of self-control, throwing a pencil across the room because they're frustrated. But for teachers to know that students, just like adults, have gone through so much during this pandemic, and all of those mental and physical signs of stress we will see in our children. And so the most important thing for students coming back, of course, is the academic piece, but is the social and emotional piece. And schools feel strongly that that's what we are here for. We are not all therapists, but we all can have a therapeutic encounter with our students, and that's what our students need. Just us showing up, school staff, teachers, counselors, it's an intervention in itself. to be there to assess what the family needs, what the student needs, and to provide resources. So we are prepared for that. We've done a lot of training for school staff, reminding not only what to look for, but what connections, what resources in the community we can continue to connect them to in terms of their clothing needs, mental and physical health needs, nutrition, housing. There's so much during this global pandemic that has affected all of our families, that it's going to be exciting just for our students to come back to school. And it's going to be an encouraging reminder to them of what is important to them and to their families, and bring them, just like us, some type of hope and joy. So I think besides the academic piece about what schools have to offer, we are excited and prepared to serve our students on an emotional and social level.
And really quickly, before we get to two other topics that I see have been raised in the chat, which are summer school and just what we can do to address these gaps of all kinds that may have developed that we're still assessing. But are there different groups, whether age or demographic, that you're more concerned about, or that the anecdotes or data that you've seen suggest may have been disproportionately impacted? And could you just say a few words about what you're seeing there?
I think, I think that the students have had traditionally challenges. Our students of color, students are English language learners, newcomer students, or special education students, students who identify as LGBTQ. Those students are experiencing higher levels of both learning loss as well as mental health challenges. And so I think when we think about the digital divide, students from low-income families not having access to the internet, we've reduced that number, but there still exists a significant portion of our families that don't have access to broadband. This has been a exacerbation of those inequities. And so those students who've already have the greatest challenges are experiencing the pandemic, and it's impacting them more deeply than it impacts other students. And so that is absolutely something that we're extremely concerned about.
And now turning, Faris, you answered one of these questions in the Q&A, but I want to ask you to expand on it. And it's the question of what is being done and what can we do to address these achievement gaps. There's funding coming in from the state and federal government. What are we doing and what can we do?
Well, we're working, so the mental health challenges, I think, requires an increase in resources and availability of mental health services, and a cutting of any red tape that would stop us from getting services to students. And when I say red tape, I'm thinking about in the past, sometimes there's challenges because if students have insurance or they don't have insurance, and being able to get them, it can sometimes delay mental health services. And so working with organizations like Pajaro Valley Prevention Student Assistance, Encompass, Community Bridges, and also clinics like Salud para la Gente and our Santa Cruz Health Clinic, making sure that we're able to get resources to students as quickly as possible when it comes to mental health services. I think all the districts are looking at contracting additional therapists and therapeutic support on campus for both individual and group work. And so that's an important part, I think, is making sure that we are really shortening the distance between the needs of our students and the services they need. When it comes to the academic achievement of students, the challenge for us, of course, is that offering more online opportunities for them to make up classes, that doesn't feel like exactly the right move when they've experienced distance learning for a year, although that is, for some students, that's exactly what they could use to make up some credit. But getting students to connect with them in person with summer school, after school, helping them get additional interventions from teachers who with experience. One of the challenges that I mentioned in the chat is that teachers are exhausted, just like our students are exhausted. And we're working on developing summer programs, but it's challenging for us right now because folks are not able, or not, teachers are very tired and not willing to commit to working the summer, understandably so, after the school year. And so making summer school programs available to students is also going to be a challenge for us. And also we've had a great reduction in the number of subs that are available to us. And so when teachers are sick or have are having symptoms from their vaccination, not being able to have subs to be able to cover for them. And so all of this really adds to kind of a layering of challenges for our programs. And so, we're working on looking at different ways that we can continue to connect with our students, thinking about different services, opportunities, and also teaming up with our community service providers to be able to continue to provide additional services to students.
And is there anything else unusual about this summer? So the hiring challenge, I'm glad you brought that up. And I think we could all understand why teachers have also been going through a lot this past year. But some districts I know are taking looks at transition programs into the fall, these other things. I mean, could you share a little bit more about what else could be the same or different from a typical summer school experience?
I think more is the key word, right? I think we want more time with our students. We need more support, instructional time, more mental health services, more connection, more engagement with our students. This one of the single most important components for student success in school, and we know this through research and anecdotally, is connection to school. And one of the things that has been most impacted through this pandemic is connection and engagement for our students. And so being able to reconnect with our students, creating safe spaces for them to be able to talk about what they've experienced, to be able to work through the kind of the mental health aspect of what they've experienced, as well as more time to be able to identify the areas that they have had that learning loss, and to be able to help them kind of accelerate their learning so that we don't derail their plans from going to college or moving forward with their experience, because that's the last thing we want to do. We want to make sure that our students continue their learning, continue a positive trajectory to their student success. And that's what we're working so hard to do to help our students get to that.
Got it. Well, I want to ask some of these questions in the Q&A, which we've been getting to quite a few already, but there are a few more that I want to get to as well. But first, I want to turn to you again, Jen, and talk about vaccinations of teachers and support staff. And again, there have been a lot of concerns. I'm not seeing many of them tonight, but in my inbox, and I'm sure yours, about teachers. It's a decision that they make whether to get vaccinated or not. And I think some parents want to know, is my child's teacher vaccinated? And maybe just explain, first of all, do you have a ballpark number of the rate of teachers that decline vaccines in the county? Is it 1 in 20, 1 in 10? And what's your ballpark number there?
Yeah, Faris may have an update because thankfully it is relatively low, and all of our school staff have been offered the vaccine in the county, and then we've gone back to reoffer it, which we will continuously for those that we're maybe debating. Faris, do you know what the accurate number is now?
Yeah, we think, depending on the district, it's between 5 and 8% who have decided have chosen not to take it, and in some cases it's related to which vaccine was available, and we think that it's going to be closer to 5% in the next few weeks.
So then let's talk about the other aspect of that. What information can or should parents expect to know, whether it's at the classroom level, school level, or district level, about vaccination rates of teachers and staff? And whoever wants to.
Could you repeat that, Nick? I apologize.
Oh yeah, I'm just asking, what information can parents expect to know about at the classroom, school, and district level about teacher and staff vaccination rates? I think teacher vaccination rates are really the primary concern for some parents, but the whole picture there.
Yeah,
I think.
Yes, due to HIPAA requirements, we are not allowed to share with the public, specifics about classrooms and teachers and who has chosen to accept the vaccine and who has not. Being vaccinated will not be a requirement. It was not a requirement for teachers, actually, by CDPH or our local health leaders. It was not actually necessary for teachers to become vaccinated to return to school. However, it is another layer, like Faris spoke about the Swiss cheese model. It's another layer of protection that we're very excited about. And those schools that the teachers that did not elect to receive the vaccine, we will continue to offer it to them. But in the end, there may be some that ultimately refuse to accept it. And for those, of course, we want them to take extra precautions, adding all the other layers of protection to their Swiss cheese model. And for students also, we do not anticipate that it will be a requirement for them when the vaccine is available to them. As we know, those age 16 and above are authorized. Our students age 16 and above will be able to accept the Pfizer vaccine that is authorized for them. And as of April 15th, that will be available to them. Unfortunately, our supply may not meet the demand in April here locally, but we think come May, we will have double the supply that we do now. And then in June, it's anticipated that we will have triple the supply here locally of vaccine. And come midsummer, we will be able to offer the vaccine to all of our community members age 16 and above. So realistically, I think it's safe to say that come next school year, that all of our 16-year-olds and 17-year-olds, perhaps 18-year-old seniors, they will have been offered the vaccine again, but it will not be a requirement. And then I'm really excited that we have 2 companies right now that are doing research on the vaccine and younger children, and hoping that next school year we'll be able to get them offered the vaccine for those that want it as well. But we understand, and the state leaders and our local health leaders understand that it's very much a personal choice.
Well, now racing against the clock here. Thanks for adding a little insight to that. But I want to get through some of these questions because they are good ones. And this one I think should be a relatively straightforward one, which is are there any districts that have not reached an agreement with their teachers unions regarding the return to in-person instruction? All 10 districts have reached some agreement, right?
Yes, all of them have a schedule of doing hybrid, or in some cases, we have some that are moving forward with full reopening.
Got it. And then also, I think we have another question here that I think is an interesting one about looking to the example of other districts that have already moved further ahead with a 5-day-a-week classroom reopening. And, have you looked to what they're doing, and what can you learn from them, and what might be different here, if anything?
Well, I think we get this quite a lot. My family member who works in this school district works at Berkeley Unified, and they're fully opening, and why can't you be like that? And I think that it is, we have networks all over the state, and we talk to folks all the time about what exactly they're doing. And the variety of different, I'll tell you, just square footage of our classrooms in the county varies significantly. And even within the county, some schools that are older schools have a much smaller square footage, and even at 3 feet, they're not able to bring back all their students. And again, I mentioned the furniture earlier, and so the uniquenesses of each of our districts creates that variability. And I think that that's something that's really important. But we are absolutely working with all these folks across the state to get ideas about how we can implement it. And there's also a lot of misinformation. We were told, for example, that this county, all their schools are fully reopened, and we contact them. We find out actually they are doing hybrid. We find out that what they consider to be full reopening is a much shorter day, and that they really have different groups of students that are coming in at different times during the day. And so there are a lot of different strategies, different approaches, and we are absolutely open to new ideas about how we can do things as effectively as possible.
And I think this is another interesting question. Is the county or districts offering teachers, site administrators access to these kinds of counseling and support services that we talked about? What does that look like on the staff side?
Well, I think everybody, almost all of our teachers have access, or all our teachers and support staff have access to mental health services as part of their benefits packages. And it is something we also are doing a lot of work in terms of supporting our teachers as they go through because they've experienced their own stress. Many of them are parents themselves and have experienced shows working from home and their kids also participating in distance learning. And so a lot of the work that we're doing and a lot of the social emotional learning components of what we offer are also about helping them to work through a lot of the challenges as professionals working in this environment. And so we recognize that this is not only impacting our students, it's impacting our staff, our support staff, our teachers, our parents. Everybody that's involved in the system has been impacted, and we need to be able to provide services and support to all of them.
Got it. And one more question from the Q&A here, and then I have one closing question if we can get to it. But I think this is an interesting one. Why it's cutting the other way from some of the concerns we've heard from parents, talking about the fact that the spring term is, not that far from ending. Is it worth it to push for a broader reopening given the constraints? Do you see that as being something worth pushing for given how hard it is? Or should we just be looking to the fall to plan that 5-day-a-week reopening?
It goes back to that whole push-pull factors, right? And that's, we've pivoted so much. So the question, kind of focuses on one more pivot. Do we want to pivot in this direction? And I think that's what the bargaining units are looking at, what our school boards are looking at, parents as well, and students as well. When I talk to my kids about going back to school and what their thoughts are, I had very different answers for my two kids. And I think that's true from a lot of parents as well. And so that's definitely one of the things we need to take a look at. There's only, if you think about it, we have this, most of us are in spring break this week or next week. So if we don't count that, we have really 7 weeks of school left before the end of the school year. So there is absolutely a consideration of, is it worth implementing this model now, or do we continue with in hybrid until through the end of the year? But I do think that we recognize that having as much time with our students as possible is something that's really is something that we want to maximize. But it isn't necessarily in the best interest of students to do one more pivot right now. And so that is part of the discussion and the decision making that each of our districts is looking at. But I do think that we are all committed to be able to open up fully in the fall.
Well, just a last question here, because I do want to shift to a more optimistic note. We've talked about a lot of challenges, but I also am curious, are there positive takeaways from, you've kind of been forced to reinvent a significant percentage of public education, or at least how it's deployed in a very short time frame. It's gone remote. Are we going to learn anything from this long term, or take anything away that's a net positive for education? And I would ask you both that question in hopefully 30 seconds or less, and then we can cap it there.
I think that I'd like to share real quickly, just the collaboration has been something that has been working with all the different groups, working with public health, amazing committed folks there. Our school nurses have been absolutely amazing. And I think really what they have done and what we've done through this process is really learn about the importance of the holistic approach, understanding that both the physical needs, the mental health needs, and the academic needs of students, and how important those pieces come together. And so I think we're going to be better and stronger as a result of this. And I'm just really grateful to all the partnerships we've developed with our private schools, our charter schools, our public schools, and all the people that are involved in this process. Jen?
Yeah, I'll just quickly add, on top of COVID and this pandemic, our community suffered the CZU lightning fires and evacuations, which was also traumatic for our community and students and families. And just like COVID, the experience has brought together, in contrast to the isolation that so many have felt, a large sense of community and what's important. And our children are incredibly resilient, as are our school staff. And so moving forward, I think we have a great sense of direction and hope.
Well, thank you both for your time, and thank you everyone for coming. I know I've learned a lot. I hope everyone else has as well. And I'm going to kick it over to Tulsi.
Yes, thank you so much, everybody, for joining us and attending our Reopening Schools in Santa Cruz County, the Experts Answer Your Questions event. Thank you, Faris and Jennifer, for joining us, and Jessica for translating for us. We really appreciate it. We'd also like to thank our event sponsor, Santa Cruz County Credit Union, and Matthew Swinnerton with Event Santa Cruz. Always a pleasure, Matthew. For the people who attended tonight's event and brought your questions, thank you so much. I just want to let you know, keep an eye on your inboxes tomorrow. We'll be sending you a 10% discount code to Lookout Santa Cruz membership, if that's what you so choose. Thanks again, and we'll be posting the recording of this on our YouTube channel and on our website tomorrow, so you'll be able to rewatch it or share it for the people who may have missed out. So thanks again.
Thank you so much, Chelsea, and thanks, Nick. And thanks to Lookout for organizing this. It was really a pleasure to be here.
Thank you.
Thanks everybody who was here.